Hi, I'm Dr. Flores. I'm one of the fertility doctors here at San Diego Fertility Center. And what I wanted to talk about today is PreCycle testing. So there are several components to PreCycle testing. And the reason why I wanted to go over it is because a lot of patients usually have questions because we do offer the ability to have several labs and several procedures done, ordered and completed before your actual consultation. So I think the first thing is, what exactly is this PreCycle testing? For our female patients, this is really looking at hormonal testing. So looking at your egg reserve, or the hormonal test name is anti-Mullerian hormone. It doesn't tell us exactly how many eggs you have, but it does give us an idea of whether or not your egg reserve is as expected for your age, or if it's a little bit lower or a little bit higher. We also do some additional testing looking at your thyroid hormone and some metabolic conditions, so that way we can know ahead of time whether or not there's any treatment from your primary care doctor that we'd like you to have done before actually seeking fertility treatment. One of the other tests that we offer is something called a hysterosalpingogram. So that's a very big name for a test that's really looking at whether or not the fallopian tubes are open. So that's normally where the egg and the sperm are going to meet. And so it's a test that sometimes can take 1 to 2 months to have completed because we don't offer it actually on site. We actually have you see a radiologist for this test, where dye is actually placed through the uterus and then x-rays are taken to see whether or not that dye actually passes through the fallopian tubes. For patients who have a male partner, one of the other tests that can be done beforehand is a semen analysis. So that will let us look at, one, how many sperm are present, whether or not they are moving forward, and also looking at the morphology, so whether or not the sperm has one head and one tail. And the reason why we actually recommend this testing is because before the consultation, is because we know that the fertility journey can be a long, stressful process. And our goal is really to help shorten the time to getting started with fertility treatment, to hopefully shorten the time to ultimately have your baby. And so with this testing being done beforehand, what that allows for is during your initial consultation, we then have the opportunity to already have a bit of a roadmap for what your egg reserve is, whether or not the fallopian tubes are open, and then whether or not, if you have a male partner, the sperm is normal. And then from there, that'll guide the discussion in terms of what we recommend for treatment. For example, would we recommend starting something called ovulation induction and intrauterine insemination? Or would we go on and recommend actually in vitro fertilization? So while the process itself is overall kind of daunting, really the goal of having this testing done ahead of time is just really to be able to have a lot to talk about during that initial consultation, and not only have this discussion, but also really get ready to move forward with treatment.